All right, let's turn to the latest now on the coronavirus, because the U.S. government has tapped Pfizer to produce millions of doses of coronavirus vaccine. This comes after the United States reported more than 1,000 deaths from COVID-19 yesterday, and the total death toll from the pandemic topped 142,000. California's case total reached 409,000, passing New York's previous record high. And total coronavirus cases around the world have now neared 15 million. President Donald Trump returned to his daily coronavirus briefings yesterday, downplaying the pandemic's impact on Americans and emphasizing that it is a global problem, while also acknowledging that tough times are ahead.
Some areas of our country are doing very well, others are doing less well. It will probably, unfortunately, get worse before it gets better. Something I don't like saying about things, but that's the way it is. It's what we have. You look over the world, it's all over the world, and it tends to do that. The governors are working very, very hard, and we are supporting them 100%. Everything they need, they get, and we are taking good care. We have tremendous supplies and a great supply chain.
Now, the president also reversed his stance on face masks, now encouraging Americans to wear them, saying they, quote, do have an impact, and also calling them patriotic. Let's welcome in Dr. Anand Parekh now. He is Chief Medical Advisor at the Bipartisan Policy Center and former HHS Deputy Assistant Secretary. Dr. Parekh, good to see you. Just first off, your response to what you saw and heard from President Trump during his briefing yesterday.
Good to see you, Alexis. This is certainly a worldwide problem, but there's something that we're not doing right in this country. We're a country with 5% of the world's population, yet a quarter of confirmed cases and a quarter of deaths. And what we've seen over the last 6 weeks is really textbook. We saw about 6 weeks ago a rise in confirmed cases, 4 weeks ago a rise in hospitalizations, and then over the last 2 weeks a rise in the death count. And as you mentioned, the first time we crossed the 1,000 death point in quite a few weeks. And so this is a really critical period for our nation right now. It's disheartening, unfortunate we're at this point. We thought that we had crossed this point back in April and early May, but it's really important, I would say, Alexis, that not just the president embrace a universal mask policy, but really all governors. We know that saves lives. We know it's really important to restrict access to high-risk settings. We can't continue mixed messaging. The American people need to know how important it is to act now. And then finally, in terms of testing and tracing, every state, we've talked about this before, really needs to ramp up testing and tracing. But the federal government really needs to step in and support the processing of testing. Right now, unfortunately, in many states, to get the results of a test take many, many days. And you really need to get the results in 48 hours to really do that isolation of cases and quarantining of contacts. And so the U.S. government really needs to step up and help with that testing piece. So it's a really critical period right now for this country.
Doctor, I want to call attention to a tweet you recently put out, and you noted in that tweet, we had an open book test and we failed it, and we still failed it. Where have the biggest failures been down in response to the COVID-19 pandemic? And when I hear you say failure, it suggests things could get worse.
Well, Brian, we traded the month of June for May, and the reopenings were premature. We saw a slight trend in the reduction of cases as opposed to really ensuring from an epidemiologic perspective that we had significantly reduced cases. We didn't have our testing and tracing capacity up to par, and we opened, Brian, with mixed messaging. So we didn't focus on the social distancing. We didn't focus on the universal masking. And as mobility increased, then there was more and more exposure and then transmission of the virus. And so we knew, and we still know exactly what we need to do. Most countries in the world, particularly if you look at European Union countries, many East Asian countries, many of the countries that we've already talked about on our program today have gotten to a point where they have not only flattened the curve, they have crushed the curve. They have very few cases. They've been able to reopen their economy. Kids are going to school. And so I think that's really, Brian, where we wanted to be at this point. This was supposed to be the summer where things are a little bit at a lull, and we're preparing for a fall and winter where we may see sort of flu season plus COVID-19 and resurgence in a second wave. But I think, Brian, that is really the frustration for a lot of medical experts and public health experts, that we know exactly what to do. We have known that, but we have not implemented that.
I want to bring in Anjali Khemlani because Anjali, I think we're all encouraged by news that the government is tapping Pfizer here for millions of doses of a vaccine. When might we see that, and what does it really mean for all of us?
But when might we see that? Actually, Alexis, is something that still everyone is waiting for. We have to see the results of these phase 3 trials that are just beginning this month for some of the four frontrunners, including Moderna and Pfizer. And so as we heard today, Pfizer has agreed to a $2 billion deal with the government to produce the vaccine if it is in fact successful. And that's only 100 million doses, but that's part of Operation Warp Speed's goal to get at least 300 million doses produced. And we have to remember that Pfizer is also signed an agreement with Britain earlier for 30 million doses. So whatever initial production it is going to be focused on, and this is through that mRNA technology, that newer untested technology on the market, that first initial batch is going to be split now between Britain and the US based on what they're producing. And the company has said in the past that they are looking to produce globally up to 100 million doses by the end of 2020, with potentially more than 1.3 billion by the end of 2021.
Doctor, what's your response to what you just heard from Anjali? Is it feasible to think we really could have something to market by the end of this year? That's only a few months away, really.
Well, there are some promising signs. As Anjali mentioned, several vaccine candidates now starting phase 3 clinical trials. This is the most important point. This is a time when you test the vaccine in tens of thousands of people, not just young and healthy volunteers, really looking for adverse events and wanting to make sure that in a randomized trial compared to placebo, that you're able to sufficiently prevent transmission of the virus. So this is the critical period. This phase 3 trials, sometimes they take months, sometimes they can take years. But the next couple of months, I think, will really be critical to ensure that we have a safe and effective vaccine. The FDA has already indicated that they're going to need to see a vaccine that's at least 50% better than placebo in preventing transmission of the virus. So they've already set that bar. And so I think there's going to be a lot of focus now on what these phase 3 clinical trials, what the results ultimately are. And Alexis, I think in answer to your question, if everything goes perfectly well, we could be in a situation where by the end of the year, preliminary interim results are positive in terms of safety and efficacy, and they meet the FDA's bar, and the FDA could approve vaccines. But again, I think in this country, we have 350 million people. Let's just say you need 2 doses per individual. We're talking about 700 million doses just for the United States. Let's not kid ourselves and think that we're all going to be vaccinated by the end of the year. Best case scenario, this is still predominantly a 2021 situation in terms of vaccinating the American public, and really for the globe. When you think about 7 billion people, 14 billion doses, that's a lot. So we have many steps, in this process. It's vaccine development, it's manufacturing, it's prioritization, it's distribution. So there are many steps, but I think some of the early indications, as Anjali mentioned, are promising.
Doctor, I have one final question for you just very quickly. It seems like everyone is calling for this national plan to help curb the outbreak, really, and that hasn't happened yet. And now we're facing this vaccine distribution and prioritization question. All told, I just want to know how you think it's possible to even, encourage the government to get on a national strategy.
Yeah, this has been frustrating because I think we've all wanted to see it first with regards to community mitigation and stay-at-home orders, and then with testing. And certainly the 2 issues that you have alluded to, prioritization and distribution, are going to be so important. Prioritization, there needs to be clear communication to the American public of who the priority groups are. And then in terms of distribution, how we get this to the end user to get shots in arms is going to be critical. And is it a public sector or is it a public-private sector strategy? All of these things require stakeholder discussions, open and transparent dialogue, and communication. So, yeah, again, another area where we need the federal government to play a leadership role and a transparent public leadership role.
All right, Dr. Anand Parekh, a pleasure as always.